How's everybody doing? My name is Alan Roberts, coming at you at 5 p.m., or excuse me, 6 p.m. I thought I would change it up a little bit, especially because what we're about to talk about here a little bit right now is on the more, public health politics side, and many people don't necessarily, want to hear how absolutely wrong they've been for 5 or 6 years. But I figured since we are approaching the 6-year anniversary, or likely at the 6-year anniversary of COVID entering America, and I know a lot of you are probably sitting back and watching this and saying, like, 6 years? It's 2025. That would mean it was in America in August of 2019. And that's very fucking true. Okay. So we're about to go over that and how that actually makes it so we should have not done anything, even though we shouldn't have done anything anyway. But I wanted to talk about the World Health Organization because I felt like, risking my assassination today. I don't know why. But, and by the way, YouTube, I know you're going to massively suppress this, so I'm just going to break it up into a billion clips and put it out there. But the World Health Organization has had a legacy of failure for global health. I don't understand why we consider these entities to have any type of credibility when they've been wrong for close to 100 fucking years about most shit. So, first, let's just go over, and this is the recent stuff. This is like from 2009 and forward. But in 2009, the World Health Organization manipulated the term pandemic because it decided it wanted to be able to name H1N1 as a pandemic. Now, the way they did this is they engineered to inflate the crisis and control it for profit, because just before they declared the H1N1 a pandemic, they stripped the definition of pandemic of its severity criteria, meaning like there had to be enormous number of deaths and illness for it to be considered a pandemic. And they still declared H1N1 a pandemic when it had a infection fatality rate of 0.02 globally, meaning like if you were a healthy younger person, it was vastly less than that. So they declared a global pandemic for this because they decided that they could strip the definition of pandemic of the enormous numbers of deaths and illness. And the only reason why I can think that they did this is because they wanted to be able to declare a pandemic of just about any fucking thing. I'm sure that, they've thought about global warming lockdowns and those sorts of things too. That could be a pandemic also. So instead they focus solely on geographic spread without any peer-reviewed science or justification at all. They just changed it. They literally just changed the definition because they felt like it. And then shockingly, a day or two later, declared H1N1 a pandemic. So I understand many of you don't want to, not believe your doctor, even though that is one of the dumbest fucking things ever said. There's been no greater profession that has misled people, bullshitted people, and caused more death and destruction than the healthcare community. Speaking as a former healthcare executive, when you think about the fact that there's 371,000 deaths just from medical error a year, which, by the way, is a higher average than COVID could have ever fucking hoped to have been, even with its massively inflated death numbers, it starts to kind of visualize that they're part of the fucking problem. They're why we're so sick as a people. They are not good at taking care of chronic illness, but you are to trust your doctor. That is a ridiculous statement, especially when you have organizations like the World Health Organization completely rewriting the rules at whenever they fucking decide to. Now, they also made sure that anybody that said anything about it was considered a conspiracy theorist, because that's the new thing. Which, by the way, I'd also like to educate a few of you people who keep calling me a conspiracy theorist. Does everybody realize that, and this is also factual, please go look it up. Don't just believe me because I'm right. Instead, listen to me and go research this shit yourself and try to get your little pea brain to realize that you're an idiot and I've been telling you the truth. So, but in reality, the term conspiracy theory was created by the CIA to stop people from talking about alternative ways that President Kennedy died. Look that shit up, because that's true. They just started calling anybody that said anything about it, the narrative that they were delivering about Kennedy being assassinated, they would label them as conspiracy theorists. And then now we realize that they were all right. It's the same thing as like the government labeling everybody as conspiracy theorists for believing in UFOs, and then in 2020 saying that UFOs exist. So they still called them conspiracy theorists, and they didn't apologize. They just keep moving on. So the term conspiracy theory normally means that you're more intelligent than the person calling you a conspiracy theorist, and you have better critical thinking skills. That's about it. Now, the redefining of pandemics was bad enough, but then they also started doing this COVID thing. Now, I say the COVID thing because while a lot of you panicked, I was not panicked about COVID at all. COVID is a fucking cold with an infection fatality rate of 0.05, according to the World Health Organization. Understand that. According to the World Health Organization, for people under the age of 70, the average, meaning it doesn't matter if the person is under 70 and 400 pounds and diabetes and everything like that, or perfectly healthy 20-year-old, the average for under 70 is 0.05. For people under the age of 20, it's like 0.000003. This was not a deadly virus. Just because they convinced a bunch of you people that it was, and they counted people that had stage 4 cancer that tested positive for COVID the day before they motherfucking died, and they counted people that got decapitated in car accidents and gunshot victims as COVID deaths because they had COVID when they died, because they changed that definition also. They just fooled a bunch of you. COVID is not a world-killing virus. If you are a healthy younger person under the age of 70, it is literally no more dangerous than the seasonal flu. And very frankly, we should have never done anything. And there's also other reasons why we should have never done anything. The World Health Organization's COVID-19 response echoed their fraud, delaying human-human transmission acknowledgement in January of 2020 by parroting incomplete Chinese data, despite evidence of rampant spread, and scoping reviews slam this as a geopolitical cowardice, mirroring H1N1 sluggishness, costing lives through tardy public health emergencies and international concerns declarations. Worse, the WHO's June 2020 claim that asymptomatic transmission was very rare defied studies showing 40 to 50% of the cases were asymptomatic, meaning that they should have immediately taken the denominator that they were coming up with the infection fatality rate and doubled it, which would have made the virus much less deadly by public admission. Now, they instead amplified their misinformation because they accused all of us of saying misinformation, but you cannot say I was wrong about COVID, because I was not wrong about COVID. I was accused of saying misinformation so much, like masks don't work. Masks don't work. Look at the Cochrane review. They do not work. They do not work against aerosolized viruses, which is what COVID is. Upper respiratory viruses travel on aerosolized vapor for up to 30 meters. If you can smell through your mask, it is not stopping fucking viruses. You're an idiot for thinking so. Just saying. Now, it's 2-year denial of airborne transmission because they denied it for 2 fucking years. Because if they say, well, it's just airborne transmission, then they can't just say, well, you have to stay 6 feet away from everybody. A number, again, that was completely made up. It just kind of appeared out of nowhere. But I am going to also remind all of you that you know what, and I can even look at this up. The seroprevalence. So let's take a look at this, shall we? They might have removed it. Bulletin. I think they've removed it. No kidding. One more second, guys. That's wild. I think they might have removed this from their bulletin, but it's okay because I have screenshots and all sorts of shit. But on the World Health Organization website is a study on seroprevalence. Here it is. Excelente. So, what's the full text? We shall go screen share. Windows. Boom, right here. Here we go. So just for all of you to see, by the way, I'll blow this up a little bit for you. This. This is infection fatality rate of COVID-19 inferred from seroprevalence data. By the way, this was done in 2020 and published on the World Health Organization website in 2021. And as you can see, the conclusion, the infection fatality rate of COVID-19 can vary substantially across different locations. The findings are that, including 67 studies, 74 estimates, and 8 preliminary national estimates, seroprevalence estimates range from 0.2 to 53.4. Infection fatality rates range from 0.0 to 1.6. corrected values from 0.0 to 1.54 across 51 locations. The median COVID-19 infection fatality rate was 0.27, in line with the seasonal flu, corrected to 0.23, also in line with a bad season of the seasonal flu. However, the rate was 0.9 in locations with COVID-19 populations mortality rates less than the global average, and it was 0.05 for people under the age of 70. So this is on the World Health Organization website. As you can see, it is the bulletin of the World Health Organization. So this is not me like just spouting shit, you know? This is not like me just saying something. This is me showing you that on the World Health Organization website, they tell you that COVID is not fucking dangerous. But they kept pressuring you to destroy your life because you're stupid. Like radically dumb. It's just fucking crazy like how we believe these people. And let's keep going here. Now, we also had the masking thing. Masking does not fucking work. And I'm going to tell you that they knew it didn't work, nor did they even try to pretend to you guys that it would work. Most of you are just too fucking dumb and too fucking big of lemmings to ever possibly question them. But first of all, you can smell through a mask. I'm just going to point that out. That blows all your shit right out of the fucking water. You can smell through it. You can inhale vapes and cigarettes through it. If it doesn't stop smoke particles, it's definitely not going to stop a virus. Stupid fucks. But beyond that, if that would have actually been a real methodology to help avoid the spread, do you not think that the public health officials would have been plastering social media, mainstream media, and everywhere they could find with the proper procedure to don and doff a mask, a class I used to teach in healthcare? Because the way people were putting masks on, where they're pulling it out of their pocket, which next to their penis, why not? Just, pull it out of your pocket. Just dirty ass hands in your pocket, put it on your face. Like, you guys don't think that that has germs on the inside of it. You guys don't think that you're increasing your risk of infection from COVID, colds, bacteria, fungus, all those things by reusing a piece of fucking cloth torn from a Led Zeppelin t-shirt that makes you feel like you're safe when another person who is fit and takes care of themselves, you're saying that they're the problem. I'm sorry that so many of you were so motherfucking stupid for so many goddamn years, and some of you are still morons thinking that masks are going to help you with any fucking thing. I mean, they help you. They help you look stupid, and they help you make sure that you're not going to breed, but they are not going to stop a virus. It's just reality. Now, they also sabotage life-saving lifestyles. Knowing COVID's IFR was 0.05 by 2021 for under the age of 70, and with high defined at-risk groups, meaning fat people and elderly people, the WHO buried proven risk mitigators like exercise, sunlight, and stress relief, which studies show cut severity outcomes by up to 42%. Instead, it fixated on vaccines and distancing, endorsing lockdowns that tanked physical activity and spiked sedentary harm, worsening health crises. Psychological research confirms WHO's fear tactics inflated perceived risk, fueling anxiety epidemics without basis, given the virus's low threat. And by virus's low threat, I mean COVID, because it's low threat. Like, if you're elderly, I'd be a little concerned about COVID. I'd be concerned about a cold, too, if you're elderly and's got a bunch of immunocompensations, which was the average person that died of COVID in America. The average COVID death age was 80, which is over the age of life expectancy. And the average person that died from it had over, around 4 or over comorbidities. Those people are already pretty fucking isolated anyway. I mean, if we didn't actually have Cuomo and Pennsylvania and a few other states, Michigan, if we didn't have them actually trying to send infected patients from the hospital into nursing homes where very seriously immunocompromised people are, and killing swaths of elderly people from nursing homes, if we didn't have that, imagine how low the numbers would have been then too. But anyway, they decided those people needed to fucking die because they're just a, drag on society. But instead, they omitted lifestyle protections and leveraged its fraudulent pandemic definition. And then they decided to look past other shit. One of the biggest things that they look past that I always talk about, and this is something that I want everybody to understand, and I've mentioned it multiple times. COVID was in the United States by August of 2019. And this is not a debatable thing. It's absolutely not. I would say it's debatable between August and September. But by September, mid-September, COVID was in the United States literally running rampant because in 2020, they took blood samples from blood donations from all over the country and tested it. And out of 7,036, something like that, cases, over 100 were positive for COVID from 2019, from December 13th of 2019. So they tested positive for antibodies on December 13th of 2019. It takes 4 to 8 weeks for antibodies to appear because the full cycle of getting infected, incubation period, sickness, then afterwards, then antibodies hit you. But it also was over 100 people from very broad geographic locations, thousands of miles apart. Washington, California, Seattle, and then there was others in Michigan, everything like that afterwards. So reality shows that it was in 2019, at least 4 to 8 weeks before December 13th. So that places it mid-November. But it was 100 people from very far geographic areas. So that means that in each of those areas, it was already spreading because they all caught it from different people. So that means that those people have another 4 to 8 weeks backing them too. So now we are at mid-October. But it's, again, roughly, if the 7,000 people were to represent all of America, it's millions of people, 5 million of people likely had this virus. We just didn't want to talk about it because the virus, the first wave of COVID-19, was in late fall at the latest through December of 2019, the first most deadly wave of COVID. And if you don't believe me about this either, please do go look up Farr's law. It is a mathematical computation that is used for pandemics to show the waves of pandemic, because almost all pandemics, in fact, I don't believe there's one that deviates, has a first very tall wave, lots of deaths because nobody has immunity and nobody has even seen this before. And a lot of times people are not prepared. So that has a high spike, goes down, then a smaller wave, 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 smaller of deaths. Now, I'm not saying cases because there'll be mutations and all like that to less harmful, like Omicron. Everyone's like, Omicron is going to kill you. Omicron is literally nature's vaccine because it was it was even vastly less dangerous than the very, 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 very weak COVID-19 original strain. And it was nothing to concern yourself about. But they tried to scare you about it anyway because it's just another form of new COVID. Oh my God, it's new COVID. I wasn't going to get scared until they came out with the Megatron variant. I just was not going to get scared until they came out with the Megatron variant. But if we keep going on, that means that for 4 to 5 months, COVID-19, the original strain with the minimal amount of people having any type of immunity to it, of course, by the way, that also means that also is not about 50% of the population, because 50% of the American population was going to have some sort of T-cell immunity, because T-cell immunity is when you catch a like virus and you develop broad spectrum immunity. And the COVID-19 virus is about 80 to 85% similar to other coronaviruses. So about 50% of people are going to have somewhere around the T-cell immunity. So now, people don't seem to grasp that because the first wave was in 2019 and we did nothing about it. First of all, it's already too fucking late, right? The government officials in America and the World Health Organization wanted you to pretend like we found patient 0 in January. Like, it's the first case of COVID. COVID started in America, January 20th of 2020, because we found the first case. I understand that you guys want to believe this pipe dream, but use logic for one second. What are the odds that for a cold with a infection fatality rate of 0.05, for most people, by the way, most people were asymptomatic. Most people didn't even know they fucking had this thing. Most people coughed twice and didn't get tested. They didn't tell you you were not afraid of this thing until they told you to be afraid, because again, it was in America in 2019 in the fall. Now, everybody I've seen, every doctor I've seen talks about the severity, and fucking Dr. Mike's debating people. By the way, Dr. Mike, if you ever want to, end your career, instead of getting all the Jubilee weirdos to fucking come at you and make you look like an idiot, by the way, they still made you look like a fool. You could debate me and I would end your fucking career. So, if people do not understand that this was all the World Health Organization literally making a power play and our CDC and government backing it up so they can suck China's dick, most of you motherfuckers need to get your heads examined. I'm just going to point that out because realistically, while I may sound like me, screaming, yelling, swearing, none of the facts I said here today you can possibly refute, because it's literally the World Health Organization and CDC fucking data. Like, it's literally their fucking data. So you can call me anything you fucking want, and you can say you don't believe me, but that doesn't change reality that what I'm saying is 100% correct, and I was right, and you motherfuckers were wrong. So I hope this was a good lesson for all of you. I hope very, very much that a lot of you started to understand that you're fucking idiots, and if we have another new virus, I really hope you bitches have learned your lesson. But if not, don't expect people like me to be as nice next time. Because while I was not that nice to begin with, I am not going to go through that shit again. Just understand that. So I hope everybody has a great, great, great day. I will be back tomorrow. I hope all of you have a fabulous day. God damn.